So in this video, we're going to talk about how I was able to improve and help this poor woman with this scar on her lips. Let's get into it. By the way, I'm Dr. Jordan. I'm a cosmetic dermatologist. And if you're new here, feel free to subscribe to the channel. So this woman came in because she had a traumatic incident that created an injury, a wound on her lip that scarred her. This injury went from her mucosal lip to her cutaneous lip. And then it started to get a little hypertrophic, so thickened scars. So as you can see in the photo, there's that nice border between the mucosal and the cutaneous lip, and that's called the Vermilion border. This is separating that normal skin up here from the mucosal part of the lip. And so you can see that scar actually crosses the Vermilion border and it really distorts the lip. And with that scar contraction, it's actually starting to distort the entire lip shape. And so this was important to get her some help. So this is a really challenging case because again, it's crossing a cosmetic boundary. So that Vermilion border is our cosmetic boundary here. And furthermore, she has pigmented skin. So a lot of people are hesitant to undergo laser, especially with heat when you have darker skin type due to the risk of hyperpigmentation. So in order to solve this problem, I really needed to evaluate what her skin type was, how reactive it is, and really kind of feel and palpate what the scar was doing. On palpation, so when I'm touching it, it feels very rubbery and very thickened. So I knew right away that we were going to have to work on softening that scar. The best way to soften a scar typically is going to be doing high potency intralesional, so injecting into the lesion with a steroid. So I counseled her on this first, that yes, we were going to be able to flatten the scar. However, she was going to be at risk for having uneven skin texture, pigmentation, etc. So I did advise that we proceed also with a laser. Okay, if you know me by now and you've been watching any of these videos, you know how much I love a CO2 resurfacing laser. This is an ablative fractionated resurfacing laser, and it really should only be in the hands of a laser expert. With this patient having a little bit of darker skin type, we really need to be careful about not inducing more pigmentation. So for that reason, before I did any laser on her, I had her pre-treat with skin lightening creams, such as hydroquinone, tranexamic acid, kojic acid, and vitamin C. So I got her in a great skincare regimen even before touching her with a laser. So then I counseled her that we need to have a series of treatments because while one treatment might be good, we really aren't going to get our result until we at least complete a series of 3, and oftentimes we need to go beyond that to potentially 6, a total of 6 treatments. So when we embarked on her actual treatment, she had used that skin preparation, that skin prep for at least 4 weeks prior. I started by injecting her with the intralesional steroid, and then immediately after, using the fractionated laser. Probably the only thing that hurts, because you have numbing before the laser, is that injection. It's never fun to get a needle in the lip or the nose or any place on the face really, but she did great. We started seeing results right after the first one, but we knew we weren't done. We did complete a series of 3 and she kept using that skincare regimen that we tailored for her. And at the end of our 3rd treatment, we had such a dramatic result. And here you can see it today. Trust me when I tell you, there are a lot of options out there for you. And I just want to emphasize, seek out some experts. We can give you guidance. If you have any questions, feel free to pop them in below. We'll see you in the next video.